Welcome to Week 5 presentation, Mental Disorders. This is Dr. Regina Glenn, and I will be hosting this presentation. Two of the concepts included in mental disorders is abuse and dependence. Dependence is a chronic condition. The patient requires a substance to maintain a certain level of functioning. Abuse is the misuse of a substance. In order to code dependence or abuse, the physician must state dependence or abuse. Coders cannot make assumptions or diagnose. In ICD-10-CM, there are three categories for conditions due to a substance. These are use, abuse, and dependence. When a provider documentation refers to use, abuse, or dependence of the same substance, such as alcohol, opiates, only one code should be assigned to identify the pattern of use based on the following hierarchy. If both use and abuse are documented, assign only the code for abuse. If both abuse and dependence are documented, assign only the code for dependence. If use, dependence, and abuse are documented, assign only the code for dependence. If both use and dependence are documented, assign only the code for dependence. As with all other diagnoses, the codes for psychoactive substance use should only be assigned based on provider documentation. And when they meet the definition of a reportable diagnosis, see Section 3, Reporting Additional Diagnoses in the Official Coding Guidelines. The codes are to be used only when the psychoactive substance use is associated with a mental or behavioral disorder, and such a relationship is documented by the provider. Selection of codes for in remission for categories F10 to F19, mental and behavioral disorders due to psychoactive substance, requires the provider's clinical judgment. The appropriate codes for in remission are assigned only on the basis of provider documentation as defined in the official guidelines for coding and reporting. This is the end of this presentation on mental disorders. If you have any questions, please contact your instructor.